Good morning. All right.
Good morning.
It is 10 o'clock. I'm going to call to order the Dubuque County Board of Supervisors joint meeting with the Dubuque County Board of Health. Monday, April 20th, 2020, 10 a.m. Go to the agenda. The first item on the agenda is item A, proof of publication budget amendment 4. And we have our budget director, Stella Rundy. I will defer to Stella.
Good morning, everyone. Can you hear me okay?
Good morning. I can hear you just fine.
Good morning.
I do.
Okay, great.
Stella, I don't see a proof of publication. What am I missing?
I saw that they were not in the packet. Megan Bonert sent them out to you this morning, just about 20 minutes ago. So they came from the auditor's office this morning. So I don't know if I have the ability to share the screen, but you should receive those in your email.
I have those emails.
Are you going to put that up, Dawn? Dawn, we'll put that up on the screen.
Okay, great. Thanks, Dawn.
I do see them here. Looks like it was published April 8th in the Pioneer and the TH and the Dyersville Commercial are 3 papers.
So I believe you would need a motion to receive and file.
I'll make a motion to approve the notice of publication or proof of publication.
And I will second that.
Okay, motion made and seconded to approve the proof of publication for budget amendment 4. Any discussion? All in favor signify by saying aye.
Aye.
Aye, carried 3-0. Agenda item B.
Okay, thank you.
Agenda item B, public hearing on FY20 budget amendment 4.
So I just want to talk a little bit about what is in our FY20 budget amendment 4. If you go to page 3 of the packet, everything in this budget is COVID-19 response related. So we can walk through what we have put into this budget amendment. There's funding for our health department in the amount of $500,000, our EMS department for $200,000, elections for $50,000, all other county capital projects $750,000, the community foundation Greater Dubuque for $200,000, our general relief to Resources Unite $100,000. In our Cdbg grant application, we had $370,012. We know now that that's not the amount, but that was the amount that was in the amendment at the time. So the total appropriations are $2,170,012, less reimbursements. That Cdbg grant is 100% reimbursable. $1,800,000 appropriations. So that is what is in this budget amendment. If we have any questions or you want to open the public hearing.
I'll make a motion to open the public hearing.
Second.
Motion made and seconded to open the public hearing on the FY20 budget amendment 4. Is there any discussion? All in favor signify by saying aye.
Aye.
Aye. Public hearing is open. We'll open the meeting to the public. If you wish to comment via Zoom, I believe you would notify Dawn Sherman here to rate by raising your hand. is the appropriate sign. So we'll give an appropriate amount of time to do that. Any action there, Don? Okay, entertain a motion to close the public hearing.
I have a
So
couple
moved.
comments, if I might.
Of course.
On line 21, which is listed as Veterans Affairs / General Relief, these are comments that I'm intending to vote in favor of amendment. But I think that we want to make that be just Veterans Affairs and remove General Relief from that, Don, or Stella, for future. I think we want to keep those two lines separate.
Oh, sure, in our resolution.
Correct.
Okay,
And just,
yep.
I guess that's a shout out to everybody. For Mary Hobble, I got a note today from Veterans Affairs, just wanting to be sure that we have those. And I think it's a good housekeeping note that we want to make sure that they're separate throughout our budgeting process as well as in our minutes. So I think that's a good idea.
Yep, that's just an
other-
oversight on that line. General
You bet.
relief is actually line 63.
Correct.
So I just didn't change the title. I apologize.
Sure. And then my other question is just generally, Stella, for accountability for each of these dollar amounts that are listed. You know, they're just general categories. I would like to, see at our meetings the recaps of how the money is spent inside the categories related to COVID-19. I don't want this to be the only time that citizens have a chance to see the budget related to the expenses that we've had and the expenditures we've had.
Absolutely. I have sent out some Excel spreadsheets for the departments for tracking purposes to ask them to be recording all expenses in real time. So these expenses hitting, we can start reporting back on that.
Thank you.
Any other questions or
I'll make a
comments? We're still in public hearing. Okay, nobody is contacting us to speak, so I would entertain a motion to close the public hearing.
So moved.
I will second that.
Okay, motion made and seconded to close the public hearing. All in favor signify by saying aye.
Aye.
Aye. I didn't hear Supervisor Wickham. Apologize.
I'm in favor of closing the public hearing.
All right,
I voted aye.
carried 3-0. All right, item C on the agenda, adoption of FY20 Budget Amendment 4.
So this would be action on page 5 of the packet. This is the record of hearing and determination on the amendment of the budget. So you would be directing the board chair to sign and the county auditor to sign and submit to the state.
We're looking for a motion to approve the adoption of the FY20 Budget Amendment 4. And Stella, do we need a separate motion on the resolution then?
Yes.
Okay, so this is item C, adoption of FY20 Budget Amendment 4.
I'll make a motion to adopt the budget amendment number 4.
Okay, is there a
And I
second?
will second that.
Is there
I will
any?
second that.
Okay, we're open for discussion. We have a motion made and seconded for the adoption of FY20 Budget Amendment 4. Open for discussion. All in favor signify by saying aye.
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 Aye, carried
Aye.
3-0. Now we have the accompanying resolution in item D, resolution approving FY20 appropriations amendment 4.
And just the notes from Supervisor McDonough earlier, line 21, as it appears on this resolution, just Veterans Affairs. General relief does appear on line 63. So it's just the title did not get updated.
Stella, I'm looking at item 21, says County Environment and Education. Am I looking at the wrong document?
Yep, so go to page 6 of the packet. It's the actual. And so if you look at the first page of that resolution, we have Fund 0001, General Basic, and then the departments underneath, which have appropriations.
Oh,
And so if you look at Department 1, it should just be Veterans Affairs, not Veterans Affairs General Relief.
I was looking at
Relief
the,
is listed.
I was looking at the prior page, record of hearing and determination on the amendment to county budget.
Yeah,
Okay,
okay.
all right, so, that is noted, that we'll, from this point on, separate, that title, or correct that title, I should say.
Yep.
Okay,
Document lists the appropriations for every department and every fund.
is there a motion on the approval of the resolution?
Make a motion to approve the resolution as presented.
Second.
Okay, motion made and seconded to approve the resolution. Any further discussion? All in favor signify by saying aye. Aye, carried 3-0. Okay, go to,
Thank you all.
thank you, Stella. We'll go to agenda item E.
Thanks,
which is-
Stella.
Okay, we had a question for Stella. Ann, did you have a question for Stella? I thought I heard something.
I was thanking Stella.
Oh, okay, all right. Item E on the agenda, update from the County Emergency Response Team on COVID-19. Defer to Patrice Lambert and/or Tom Berger for their report.
Okay. Good morning. This is Patrice. I don't know if Tom is on or not. I just always begin by saying who the members of the Incident Command Management Team are, and that is Tom Berger, our EMA, Stacy Killian, our Director of the Visiting Nurse Association, Mary Rose Corrigan, City Health Specialist, and myself. And we do continue to meet on a daily basis, actually 7 days a week and more if needed. And just a couple of things, as you're all aware, yesterday was our highest number of positives that were reported by the governor. I believe it was 389 additional positive cases yesterday. And that brought it to the state of Iowa, a total of 2,902 positive cases with an addition of 1,214 negative tests. Dubuque County did have an additional case yesterday, and the new data is not out as of yet for today. That will be released probably within the next hour or so. We did have lots of calls over the weekend regarding the new proclamation of what can and what can't be done, what was mandated, what was not mandated. And we did answer all of those that did come in per call or per email. We are also just now finalizing our business letter that will include the Iowa Department of Public Health new guidance for the businesses and the workers. We'll be getting that sent out. We'll work with the chamber, and we'll also follow up if businesses are not members, we will follow up then per mail to get that information out. And then we're also looking at doing spot checks with phone calls to these businesses and retail stores just to see, probably once a week, just to see how they're doing. Do they have any questions? Do they have any concerns? Just getting basic information out so that they know that if they do have any questions or concerns, of who to contact and how to contact us. And we're also just finalizing the grocery store information. The city grocery stores all received their letters last week, but for the county, I had to wait for the approval from the DIA. I just got that Friday night, so we're going to be sending that out to the grocery stores in the county now, and it's basically just again, controlling and monitoring social distancing, just, again, guidance for the grocery stores. And, again, we will follow up with phone calls for them periodically as well. And, Anne, I don't know if you had a chance to look at the website, but I was working with Karen on that last week. And I'll be honest, I did not even have a chance over the weekend to look at it. But if anyone sees anything, differently that you would like removed or added or suggestions, please just email Karen or else myself. And let's see, on Wednesday then, we did ask Chris Corkin, who is the chair of our Brain Health, Mental Health subcommittee, to present to this group. And she, through her subcommittee, has gotten lots of resources, and some of those resources we were already able to send out through Kim Gonzalez with our daycare providers. But she'll be here to present all of their work, and it's been very good, that's for sure. So that's my update for right now as far as the county emergency response plan, or the county emergency response team update from me. So I can turn it over to Tom unless you have specific questions for me.
Do you have any questions for Patrice?
I have a few, Patrice.
Sure.
The grocery store letter, is it possible for you to present that to us on Wednesday so we are aware?
Absolutely. Sure.
And you said it had to be approved by DIA. I don't know what that is. Department of Inspections and Appeals?
Yes, correct. Before we could send it. We have different food inspectors for the city as well as the county, and our food inspector had to get the clearance through DIA before we could send it out to the county. So yes, I'll be glad to get you a copy of that.
That would be helpful. And then I had
Sure.
a question about, the numbers are spiking throughout Iowa. Of course, it's related to long-term care facilities, and the other is the meatpacking industry. In Dubuque County, I think probably the only thing we have close to that might be Hormel.
Yep.
And is anyone proactively looking at any policies, procedures there so we don't have an outbreak?
Yes, and I believe Diane Freiberger is going to, well, Diane, you correct me, but I thought she was going to address that with our next agenda item. She did send out an email on that, and I will also share that, yes, I'm in communication with our Iowa Department of Public Health epidemiologist to see if there is anything that we can proactively do with our Hormel plant at this time.
So we're not actively, aggressively pursuing that? We're just kind of stepping through the steps?
Correct. At this time, you're correct. But now that could change.
But if Tyson had a chance, if we had a chance to do it over in some of the other plants, maybe their Board of Health would do things differently to maybe localize a response. So I'd like to have us, if we have the benefit of a few days of action, who might be able to make the phone calls and, monitor that better.
Yeah. And I do know one of our Board of Health members did respond last evening and did say that they did talk with someone who had worked at Hormel, and that starting today, all of their temps all of the employees' temps would be taken before entering the workplace, and that they must wear masks at all times and keep it on until they reach their car after they leave the plant. So the person that our Board of Health member was talking about felt as though that they are looking at the employee safety right now.
And what are we doing for any verification?
No, we can follow up, Ann.
Okay, thank you. I'd like to see that be addressed again on Wednesday. I know you can't tell me whether or not anyone there has tested positive, but certainly, we shouldn't overlook the obvious if that's the hot spot around the state and throughout the Midwest.
Sure. And I could just ask Diane Freiberger, would you like to talk about what you had emailed? Is Diane
Yes,
on?
I can.
Okay,
That was going to be part of my report on testing, but in response to the other Board of Health's statement that they had heard from employees at Hormel that they were doing this, that they were, taking their temperatures, having them wear a mask until they get back out of the building and into their cars. I'd had communication with Dr. Vanderheide at United Clinical Labs. And as of 10 o'clock this morning, they still have only 18,000 test collection kits available. And the concern would be if we burn up the 18,000 by testing employees anywhere, that we will not have additional to test our most critical patients. And I agree with that. And we've been pushing, United Clinical Labs has been pushing, but the test availability is not there because we do not have the reagent to make more test kits. They don't have the ability to do that. Also, effective this morning, and if Patrice can't follow, she can let me know if she wants me to follow up with Hormel to validate that that's actually what they're doing. I can do that for her if she wants. She can send me a text message or an email after this meeting. And also effective this morning, all Walmart employees also are mandated to wear masks. And I did go over there to validate that. I went to make sure that I saw the employees wearing them, and they are wearing them. The employees are complaining that they have to wear them, and if it was up to them, they wouldn't have to, but I thanked them for wearing them and encouraged them to wear them. When companies mandate anything, there has to be an education piece that goes with this too. And I'm concerned that when people are being mandated to wear them at work, that they should also be informed why and should be thanked for doing that for the rest of the community and for their coworkers.
Thanks, Diane.
Mm-hmm.
Patrice, this is Diane Hyken.
Uh-huh.
Hi, I just have a quick question circling back to the grocery stores. I'm not sure what you're defining as a grocery store because a lot of places have perishable food in Dubuque or non-perishable food. Are you only referring to places that have non-perishable food departments?
Yes, correct, at this time, but we will cover the other ones through our businesses. I'm just trying to see if I can pull up the draft of the letter. Hold on one second. You can keep going, and once I find it, I will.
No, that was it. Just a basic question as to how you're defining a grocery store. Because where I work, a lot of people are getting their groceries. We don't have perishable things. Well, we have coolers and freezers, but not like specific produce departments or meat or anything. But I'm just wondering because we still have a lot of foot traffic where I work, and that kind of. Yeah. They're taking care of the masks. We're mandated to wear them, but other direction is always appreciated. And I appreciate all you're doing, Patrice.
Sure. Well, thank you. And for the life of me, do you know what? I'll send out to you those that do get. For the life of me, I have 3,000 emails, so it's kind of hard to go through. I'll find it and I will send that out, and I'll also include that, as Ann had said, for Wednesday. But we will hit the other, it would be the places that are inspected by our food inspectors that we have a specific letter going to, and then the others would be through the general businesses. And I apologize, I cannot find it at this time. But I will include it for Wednesday.
Thank you.
Thank you.
Sure. Well, thanks you, both of you guys, for all of your help. I appreciate it as well.
Okay, do we have any other questions for Patrice? Not, I think Tom Berger is on.
Yeah, I'm here. Just giving an update. We're still getting the process smoothed out for the order and the supplies. We requested more again from the state. The hard part we're having now is the gowns. So we did send out some guidance from the CDC and the Iowa Department of Public Health about additional things they can do with gowns, as well as been working with one of the supply officers or purchasing officers up at Findlay, and they're looking at some other alternatives once the gowns are no longer available. So we did also order kind of like the ponchos, and hopefully they would work. So we have some of them coming in through the internet, hopefully by the end of this week. So if it gets down to that desperate area, at least it'll be some kind of protection for them. So with that, I don't know, Dave, were you going to talk about the code red call that went out on Saturday, or do you want me to kind of summarize that?
Yeah, if you would, that'd be fine, Tom.
Okay, the call was kind of twofold. I mean, obviously to get an important message out to people as far as the what Gary Dolphin and Chair Baker and Mayor Buell did, but also we were due for our annual or biannual time where we call all the database. And what that does is it allows us to scrub the database. The company now runs a validation process on it for the next couple of weeks, where they will call the numbers that have the disconnected signal. And then if they get that 3 times on 3 different days, then they take that number out of the database. So it was due for that. So we kind of did both of them. I thought it was an excellent idea that they had through the JIC and Mike, the city. And so we're working that process too. So it's it was due to happen. So then that allows, if we have an emergency, it doesn't waste time calling numbers that are disconnected. So I got a lot of positive comments about the call too as well from the county area. So I think that's what I have for today, unless you have any questions.
Tom, this is Diane Page Freiberger. I have a question regarding hand sanitizer. It was my understanding that Dubuque County purchased a large volume of hand sanitizer a month ago, maybe, from Higley Company, hand sanitizer. And then I saw in the newspaper today that another distillery in Dubuque is making hand sanitizers for one of the county long-term care facilities. Was any of the original hand sanitizers that we purchased, which was a large volume, did any of that go up to that institution, to the facility, or is this duplication, or do they need more?
Well, I think there's a lot of businesses that are making the hand sanitizer, a lot of the distilleries. The facilities are supposed to procure their own. We do have some out here. The problem wasn't the hand sanitizer, it was the packaging of it, and getting into something that the facilities could use. So we did deliver, so I don't know which place you're referring to, but we did deliver some hand sanitizer to a couple of long-term care facilities, and what we gave them, they gave back to us that it wasn't usable for their needs. So we did not get a big, we did get some in from the state, we did get some in from Higley, and also we can contact him as we need more. So we did also last week get in some smaller containers, so we're filling them here. It's just trying to market them or to get them marked so, you know, they're not confusing, especially they'd never be able to be used around where there'd be small children, you know, because they look like, you know, without the warning such, we wouldn't want them to be able to pick them up, you know, and think it's like a bottle. So.
Okay, any other questions for Tom Berger? Tom,
You are muted.
I have a question for Tom. Tom, is there any update? I know it's probably a national or international issue.
You are unmuted.
Acquiring or ordering additional PPE for the medical community, and then if it's being ordered, what is the turnaround expected delivery date, even if it's out there a ways?
Dave, I'm sorry, I missed the first half of your question.
I'm just asking if there's any update on acquiring or ordering PPE, and if there's any, is there any manufacturing of PPE in progress that might bring us more later? I'm assuming the PPE, the gowns are the big issue. I know you talked about some alternatives and some of the standards for reuse and that type of thing, but is there any projections on when additional gowns, protective apparel will show up?
I don't have any protection or projections on the gowns. I know when I put my order in through the state, I seem to be getting about 10 to 20%. That's why they're still doing that 4 to 7 days out to kind of get PPE where it needs to go statewide. So we're hoping that some of them other alternatives, if we can get, we ordered over 2,000 of them, and then we'll get them out to the health facilities to say, hey, if this would work for you, we can try to get more if they come in. But I think it's like everything else. It just says the state is finding out their vendors are telling them it should be here this date, and then all of a sudden it's back ordered and pushed back. So I think it's a nation or worldwide problem. So I don't really have a good answer for you,
Okay.
Dave. I'm sorry.
All right. Well, at least it's an answer. All right. Any other questions for Tom Berger? Okay. I think at this point, I'll move to Tom Beschen, the chair of the Dubuque County Board of Health, and let Tom conduct the Board of Health portion of the meeting. So Tom, I'm turning the gavel over to you figuratively.
Thank you, Superintendent Baker. I would first start by noting that we have 4 members of the Board of Health on the call today: Valerie Pekash, Diane Heiken, myself, and Diane Pate-Freiberger. So we do not have a quorum. But our topics for today was a test site update, and we do have some information from the local test site regarding their budget, as well as an update from Diane Pate-Freiberger. So I will let Patrice lead off with this funding from the local test site.
And this is Patrice again. And in your package, you would have seen the proposed budget for the test site, the estimated cost. And this will be budgeted through our $500,000 that the Board of Supervisors have given us. And what it is different from last Monday when Mary Rose Corrigan did the presentation on the committee overview was the daily costs for the community test site for approximately 21 days, the fixed setup costs, and then the staff training and preparation costs for the total request, which would be $193,200. And those actual costs may not reach that total amount, but the update that I wanted to share with you is that we will be beginning the staff training for the dry run and the PPE training because we just want to have this done in case we only have a 72-hour notice to set up our test site. At least we won't have to worry about orientating the staff. So it does appear this week the staffing orientation will begin, and I don't know if it'll be that total $9,000 that has been estimated for that, but I just wanted to share that in your packet as well. And Stella indeed did give us a worksheet, so we will be putting all of these costs right into that. So, and then Diane, do you want to follow up? Diane Freiberger?
Patrice, this is Tom
Oh,
Besh.
sure. I'm sorry. Yes.
Could I add one comment regarding
Sure.
the document that people are looking at?
Yes.
If you look at the second highlighted row or the third highlighted row, it says total weekly costs. That should read total daily costs.
Thank you.
Because if you take 8 times the 8,315, you come up with the 58,000 that's talked about for a 7-day period.
Good eye. Thank you very much.
That's all I had.
And then Diane Freiberger?
Yes, I will give an update on the testing site and also on testing for Dubuque County. And just a quick note that at 1 o'clock this afternoon, Diane Heiken has made contact with the chair of the testing site, and Diane Heiken and myself will be meeting with the chair of the testing site for Dubuque County at 1 o'clock this afternoon. We also note that the hospitals and medical groups in Dubuque County have already stated, and they currently state, that they're able to provide the number of tests on their sites without opening a remote site at this time. So we note that could change at any point, and thank you for preparing to get this ready, and hopefully less than 72 hours if needed. And I think that we all know that at the current time, the issue is that we only have these 18,000 test or collection kits available. You know, that in itself is a barrier to testing more people. But what's been happening throughout the state is if there is an outbreak, either in a long-term care facility or in one of the meatpacking plants, which has been happening through the state, hopefully not in Hormel, okay, that the state has been increasing the resources that they distribute to that site. So we are hoping that they will do that if something like that happens here also. But I want to start by saying that last Wednesday on April 15th, I had asked Patrice for clarification on whether local healthcare providers could develop their own criteria for determining the priorities for testing of individuals with suspected COVID-19 infections. And if they needed to use the state hygienic lab to run the test. And in a quick turnaround time, I got an answer to that, like within an hour, that Patrice sent the email to IDPH, the Iowa Department of Public Health. And they responded that if a medical provider or a lab is not sending the collection kit to a state hygienic lab, if they're sending it to Mayo Clinic, or if they've been certified to run it in their own lab, they can develop their own criteria or priorities for testing. So with that, currently the hospitals and clinics in Dubuque are using United Clinical Lab, UCL, for all their testing. So a healthcare provider may obtain the test at the provider site, then United Clinical Lab receives the test that's been, the sample that has been taken, and sends it either to the state hygienic lab or Mayo Clinic with a 2-day turnaround time. With the rapid test machine that they are able to run the test on site and let the patient know in a short period of time, they do not need to wait that 3 days, 2 to 3 days for the results. They can have that within 2 hours is what they're telling people. The problem with that is, again, they do not have enough collection kits to do this. And they are also looking and trying to determine which of these two methods, the one where they put the swab in the nose, the nasopharyngeal that has been used more widespread, or whether the rapid test kit is most accurate. They want to get the most accurate because you don't want to be reporting negative results if a person's actually positive. Now, I checked on with Mayo Clinic, and their criteria does not include those exposed to a person with positive COVID-19 results. And they also, so that broadens the criteria. They can test individuals that live in close proximity, which we have that within our own community in Dubuque, City of Dubuque, Dubuque County, or they could also, the criteria could also test if a person that works next to you in a factory is deemed positive, then you could, with Mayo Clinic's criteria, you could also be tested if you request that. Again, all these things take a physician order. We would need either standing orders, even for this remote test site, they need standing orders from a physician. So to accomplish any change in criteria, there must be a lot of collaboration among the physicians, United Clinical Lab, and the healthcare institutions in Dubuque. It is positive to include additional persons exposed to the criteria if the collaboration occurs and either the rapid test is used and run by a United Clinical Lab, or the nasopharyngeal swab is used and sent to Mayo Clinic to be run. If that nasopharyngeal swab is being sent to the state hygienic lab, we would need to, again, follow their criteria. You have to follow the criteria by whoever is running the test. Okay, and back to this, I had received this information this morning at 10 o'clock this morning from Dr. Vanderheiden, who is a pathologist with United Clinical Lab. And just to reinforce, we have 18,000 kits available, and they are going to reserve those for those that are the most critical, and using the guidelines that are being used by the state hygienic lab. And they do go to the state hygienic lab or Mayo Clinic with a 2-day turnaround time is what they're seeing, meaning you get the results within 2 days. And United Clinical Lab also has the ability to send antibody tests to Mayo Clinic, and that may be available, more may be available for antibody testing next week, when United Clinical Labs will have the ability to run the antibody tests themselves. But back to, we need collaboration. We need to have a physician order. I had a conversation with Dr. Bobby Canero, actually talked to him, and not emails or text messages, on Saturday morning. It's interesting how just to hear a voice is great nowadays. But, and he is the Board of Health medical liaison. but he's in the clinic this morning and he said that he would not be able to attend this meeting. So after a conversation with Dr. Bobby, we concur that testing should be done in two paths. First is increase the number of nasopharyngeal tests, the nasal swabs, and rapid tests, with more people being allowed to receive the test by changing the priorities, criteria for testing. This would require collaboration again. And that would also require more availability of those test kits, the collection kits. Second is to begin planning for serology, which is antibody testing, when an accurate test becomes available. This could potentially happen in a few weeks to a month. The goal would be to collect and utilize data that are needed to safely open up the economy and open up social restrictions. This planning step should be starting soon, and by assessing the antibody results, the county and city will be able to determine the extent the virus has circulated in the community. Again, the medical community and United Clinical Labs needs to be in collaboration to allow this to start. And also, we would also need to add employees that have been exposed to a large number of people because of their employment, but they may not have exhibited symptoms. They may have been asymptomatic, or they had mild symptoms. That helps us to determine how that virus is circulating in our community. And are there any questions for me at this time? I am not an expert in this field, but I'm just giving my professional opinion.
Diane, this is Diane Heiken.
Yes.
And just to clarify, we don't actually have a meeting set up at 1 o'clock with that person. That they responded, the chair responded that was their next available time, and they would try to get back to us. But hoping that we can connect today with the chair of the testing site.
Thank you for that information, Diane.
Yep.
And is that the chair? This is Ann McDonough. Is that the chair of a subcommittee? I mean, chair of testing site. What does that mean?
It is last week when Mary Rose Corrigan gave her report, I believe it was on page 2 or 3, she listed all of the people that were involved in the testing site subcommittee. Yeah, it is the chairman of that subcommittee.
So it's a local person that you're trying to get on their schedule to talk about these increased testing measures. Okay, and do we have any reason to think collaboration between our physicians is not going to occur to broaden the criteria?
That would be a question we wanted to discuss with that person and get an idea. We've not had any discussions yet. Patrice has had to kind of be the go-between. So we just wanted to have a direct conversation.
Wonderful. Also, then I had a few people had actually asked me this question about the cost of the test. Who's paying for the tests and who's going to be paying for the antibody tests? Where's the funding for that coming from?
That question. Oh, I'm sorry. Go ahead, Patrice.
No, you can go.
This morning, the question was asked to Dr. Vanderheiden, and he has not yet responded. But then again, he had just offered me this information on the number of test kits at 10 o'clock this morning. But the question has gone to him, who is assuming the cost on this.
Yeah. And
right,
this is Patrice. It's my understanding. It's my understanding if we continue to send to the state hygienic lab, there is no cost. But if it does go to Mayo or another private lab, there is a cost, but I do not know what that cost is. So that would be something.
Yeah, we probably better figure that out before we start opening up a test site.
Absolutely. Well, and I believe the test site, which Diana and Diane can confirm this afternoon, I believe that was going to go through the hygienic lab. But if Diane and Diane can double check that this afternoon, that will help immensely.
Okay. On the topic actually of Diane and Diane, I want to thank you both for being out on the street on Central Avenue, handing out and training citizens on face masks. That was truly wonderful to see that. So thank you. That's you volunteering more of your time. And I was delighted to see that the dinosaurs walking down Central Avenue were also offered masks, and apparently they don't fit. So that's interesting. Social distance will be what dinosaurs will have to use.
And this is Diane Pate-Freiberger. Just to clarify, we were actually helping Key City Creative hand those masks out, and took the opportunity also to educate that population on social distancing and keeping their space away from each other. But it was a very valuable experience. They get it. They actually get it. They came thanking, wanting these masks. They felt it was very important, but they had no car rides to go get the free mattress. And it was a very valuable experience to do that. Thank you.
So you're talking about the citizens who live in the area, the neighborhood of Central Avenue, where you were, that this was the first outreach they might have had about this issue.
That is correct. It was the first time that they felt left out. And so I'm glad that we were able to offer these to them. And they may not have, there was quite a few that may not have even had children at home, where they would be going to one of these food distribution sites where they're being offered currently.
Mm-hmm. I wonder if we shouldn't be looking at community outreach now that you've seen, firsthand that it's not necessarily occurring, how we might increase that communication in the neighborhood.
And Susie Stroud is the chair of this, and she is actually right now doing that.
Wonderful, thank you.
I'd like to, this is Supervisor Wickham, I'd like to go back to the testing, and I would also like to thank Diane for that report that you had related to testing and your ideas and thoughts on that. I think that's the next stage that we need to really continue to focus on as a group. So I'd like to see continued efforts on that, and would really encourage and empower the Board of Health and the members of the Board of Health to be an active role of that. And so I greatly appreciate your starting that process. My question would be, is why isn't the Board of Health why are we delegating that authority to another testing group? I know we need to coordinate and we need to certainly cooperate with all the medical community and others, but it seems to me that the power and authority would be with the Board of Health. That's the state code that dictates the establishment of that board and the power and authority of that board. So I don't know if there's any further discussions related to that. I'm very encouraged by the discussion on testing, because I think we need to go there, but I would be very cautious in delegating authority and waiting for others to solve this testing issue for us.
This is Diane Bacon. So a test would require an order, much like a prescription. And I don't think there are any of us that have, the authority to do that. We do have a physician on the board, but I don't know that he has taken the step to say that he's willing to write the prescription for every, or write the order for every person to be tested.
Yeah, agreed. I'm looking more high level, organization, budgeting, authority, not the doctor prescription level. I certainly understand that wouldn't be the Board of Health's authority, but just the overall command and control of creating a testing environment and creating the testing criteria and working with those groups. But I'm asking the question, and I'm certainly trying to empower, and I think the Board of Health should play a role. But if the Board of Health is not comfortable with that role or wants to delegate that role, that's the discussion I'm interested in having.
Who would we delegate it to?
Well, I hear this testing group, and that was mentioned just a few minutes ago in a chair of some testing group. So I was questioning that.
And this is Patrice. With the state hygienic laboratory, if the tests were to go there, they would be free of charge. There would be no cost. However, I did fail to mention that any test that still would go to the hygienic lab does have to still follow that current criteria before someone can be tested. Whereas the other private labs and the mail do not have that criteria attached as the state hygienic lab does, but then again, there is the cost. So we would have to look at billing the patient or other funding sources from that. But again, I do not know the cost for those.
Patrice, this is Diane Pate Freiberger, and that is also why we're working with United Clinical Labs and Dr. Vanderheiden, because and to determine where the cost would be incurred there and what the cost would be, and with their ability to request more test collection kits, that is it part of the barrier that that the financial aspect. If you purchase anything, you pay up front for it. Sure. As far as the number of test kits there. So if that is an issue, is there something that we can help them with financially so that they can get more reagents?
This is Supervisor Wickham. I keep hearing financial issues. The Board of Supervisors appropriated $500,000 to the Board of Health. Is that exhausted in at zero? Why is financial consideration still being a barrier? Do you need more funding?
No, I just do not know what the final cost is, and I need to find that out, or one of us needs to find out how much.
The Board of Health members, is funding an issue for you? Do you need more funding?
Jay Wickham, this is Diane Pate Freiberger. The health of the community is my top priority. I do not allow financial barriers to be a decision in making that decision what's best for the community, but all of us do take a look at what is the best way of doing it financially also. And I have no problem, working with the incident response team or the larger team and this chairperson. If they have things already set up, we do not want to interfere. We are offering that we will work with them. We want to be able to give our input, and I think that we have said that for a while now. I think we're just being a little bit more assertive at this point. And yes, the Board of Health does have the authority at this point, and we want to work with everyone, including the supervisors, including each other. And so that is why we want to be in discussion with that chair to make sure that we're all on the same page and go in the same direction.
Good. That sounds wonderful. I just didn't want to agree with you related to the not having financial barriers to getting people healthy tests. And we've appropriated the funds, and hopefully we can work together to administer the tests. And it sounds like we're on those first early steps. So I'm encouraged by that, and we'll try to do our best to empower the group to move forward more proactively.
I'm finished with my report. Are there any other questions? Thank you.
Okay.
Diane.
Thank you, Diane.
Chair Beshett, if I may, Dave Baker, I just wanted to comment and thank Diane and all the Board of Health members for their work on this. And Diane, I think you said something about that you're not necessarily an expert on this, but I think you are becoming our expert on this, and I, for one, really appreciate your efforts and the entire Board of Health, their efforts in battling this pandemic and trying to get answers and work on the expansion of testing. So thank you.
And thank you, Patrice, for all of the hard work that you're doing. And I know that you're working tirelessly, and the whole committee is. Thank you.
Well, we're all in this together, so thank you.
Okay, this is Tom Beschen again. The next item on the agenda, county plans for potential positive COVID-19 case. I guess I am not sure exactly what this is. The only other thing we had for the agenda was was masks, but that is being moved to Wednesday, along with the discussion from Chris Corcoran on brain health. So if that's all the Board of Health has to add at this moment, I'd turn it back over to you, Supervisor Baker.
Tom, this is Diane Pape-Freiberger. Just a remaining question from what was brought up last week, and that is, is Crescent part of this planning? And where, I know that they were awarded a large amount of federal dollars, and that they had earmarked a good portion of that for testing. Patrice, do you know where we're at with that?
I believe when you meet with the chair, she'll be able to fill you in on the updated grant information. But yes, Crescent has been involved with this testing site.
Thank you.
But I don't know what extent now that they've been awarded that grant. But the chair would be able to fill you in on that.
Thank you.
Thank you.
Okay, this is Tom Basham again. I guess I do have one other comment, and I'll share it at this point. Last week, we tabled an item regarding the isolation and quarantine. We have since worked this out with the county attorney and the Iowa Department of Public Health. Under the current guidelines, the executive director, Patrice, has the authority to issue a verbal order. Within 24 hours, the board must act and issue a written order for that isolation order to continue. So those are the processes we will follow. We will make every attempt possible to schedule, meet, vote on a continuation of the oral order and get it in place. So that issue is no longer part of what we need to be discussing at this point, unless anyone has comments.
Anyone raising their hand, Dawn?
Okay.
Looks like no one asking to speak, Tom.
Okay, with that, I'll turn it back over to you, Supervisor Baker.
Okay, thank you, Tom. All right, item number 2 under section F is county plans for potential positive COVID-19 case. And I'm gonna defer to our Human Resources Director, Dawn Sherman, for some information on this topic.
Thank you, Supervisor Baker. You had received an email and asked that this be put on the agenda. So I'm going to be working with Ed and some of our other department directors to have something for Wednesday, because obviously we have various buildings that complete different functions. The jail process may be different than the courthouse versus Sunnycrest, so I'm going to need to reach out to all of those elected officials and department heads to incorporate their plans if they have a positive, and then one for just our general buildings as well. So we're looking at having that and communicating that out so that our employees have some peace of mind that they will know what to expect if there is a positive in any one of our facilities.
Okay. Any questions for Dawn Sherman on the potential for positive COVID-19 case for Dubuque County? And with that, we're talking about Dubuque County staff.
That's correct.
Dawn and McDonough, to get this ready for Wednesday, it's very difficult to do that and send it out in any kind of packet form. Is Wednesday realistic? Should we be looking at this for Monday? So just so you have time to develop this and get input from people, you know, it's the county plan. Certainly we want to have something in place, but I think we want to have the opportunity to think it through.
You know, let me get the the stakeholders in place for that. At minimum, I think it would be good to have board participation in that development of it. So, yeah, I will let you know, because I would have to have it before 10 tomorrow in some form to include in the packet. So it may not be a final plan for consideration, because I think we do want your input along with those of other staff. So I can't say it would be in a final form for Wednesday.
So Dawn, that'll be included in the packet, and then we'll have time to discuss it, and if we feel we need more time, we can, you know, move it forward, to another meeting. Okay. I think it's good to have something to, at least go over and, make sure we're getting a plan in place that's well thought out. So, appreciate your efforts on that. Any other, comments, questions on the county plans? Okay.
Well, Supervisor Baker, I don't know if it just came in this morning at 9 o'clock, and so if my colleagues have read it related to courthouse access, if there wanted to be any discussion for that or potentially for Wednesday.
Okay. What's that? Are you referring to Shane Backenstedt's input?
I am. So obviously it's a 3 or 4 paragraph email about concerns about people in the courthouse and their condition, and then potentially spreading their condition. So if you look at the numbers, we still have 70 or so people that, if not higher, access the courthouse each and every day. If the Board of Supervisors still think that's the risk versus reward is worth it, and we keep our status quo and delete the email. Otherwise, we can have further conversation on it.
I guess I thought the email was going to serve as part of the conversation that Dawn would have with our department directors, looking at actual experience and what we are experiencing and how we're responding to folks who we had an employee who had a cough. So, getting all of that part of a thought through process and a response to that, I think, is going to be helpful for everyone's well-being and safety, but also just feeling like we're secure in our workplace. We will need to have, Chair Baker raised the requirement of making everyone be required to wear a face mask. That's not before us here again today. So, maybe we need to have that be part of an update from HR on what we are experiencing throughout the departments. Where are the department heads on asking their employees to wear a mask? Did we get 1,000 masks for county employees? I think we need an HR report that includes all of these things. Again, I don't know if you can do that for Wednesday. It would be a priority for me to have that, Dawn, a report for us about information that's coming from the different buildings and the different departments.
Yes, I will have that in the packet for tomorrow.
This is Diane Hyken, Supervisor McDonough, and that was asked about the Board of Health last week, and a statement has been drafted, and I believe Patrice will have the update with how many masks have been delivered, because the mask report was tabled to Wednesday. I believe that's why it wasn't in ours. Tom Beschen can confirm that, and Patrice.
Okay. Looks like Wednesday will be the day for lots of updates.
Well, I mean, the email was directed to the Board of Supervisors, so, I mean, it's very easy for us just to delegate responsibility and do nothing. I would ask my colleagues to take a little more active role.
Yeah, at the last meeting, thought that I was trying to address that by talking about whether masks should be required. I think right now they're being strongly suggested nationally. And, so I guess I wanna be able to talk to, Shane about, his concerns. I'm not finding his email, so I don't know if I was accidentally left out of the loop or if I'm not able to find it here, so. I will reach out to Shane. All right, any other comments, questions on the county plans for a potential positive COVID-19 case and related issues? Hearing none, we'll move to the item G on the agenda, Cdbg Grant Award. And
This will be a receive and file, but we did want to take note of that award for our various partners throughout the community.
Dawn and McDonough, did you get back to ECIA? They drafted that grant application for us, and I want to be sure that, one, we express our gratitude. I know there's no funding inside this for them to do any administering. We're going to be handling all those administrative pieces ourselves, unless we choose to purchase that as a service from ECIA. And I don't think they seem to think that because of the things that were funded, we probably can handle this on our own. But did you reach back out to our partner there to make sure that we've concluded our responsibilities with them?
I have only been in contact with Mark. I will reach out to Kelly. I've been in contact with Mark regarding this in another shared project that we have, but I'll contact Kelly directly for it.
Sure. Thank you.
I would, Dawn, like to see about getting some input, whether that be Kelly or Mark, about why it was scaled back so much. I'm happy that we were successful in getting this almost $100,000 grant, but I would like a little bit of input, if we could, about why it went from 370,000 to just under 100,000.
I can share two things on that. Based on an email that she had sent us, the state had reached back out to them. Initially, our proposal was for 12 weeks of services, to expand services for 12 weeks. They came back and asked us to back that down to 6 weeks. And then we also took out, I believe it was over 30,000 in administrative cost, because we will do that internally here. So I did not have the specific conversation with the state, but that was based on Kelly's email to us.
I think it's worth noting that it is the largest grant, I think, that was awarded to date from those funds.
I don't know if you can hear me.
Go ahead, Ed.
You can hear me. Also, I think another mitigating factor is that the state only had a little over $2 million statewide, and we were, in essence, asking for over 15% of the statewide pot for the part of Dubuque County that isn't the city of Dubuque. I just didn't think I don't think it fit in the overall budget with the other requests that came from other municipalities and counties around the state. And as Supervisor McDonough pointed out, as far as I can tell, through last week, it was the largest award they had made.
Okay, well, that's helpful, and part of my question is to get that out so that people understand, because earlier in the budget amendment, we had that higher number and ended up being 99,000. So I appreciate the input on why it was reduced. Apparently, probably the top mitigating factor would be lack of funds. Maybe that was overly optimistic on the amount of funds that were going to be available, it sounds like. And that's, that's understandable. I just want to make sure that in a public meeting, we have that discussion so that people know what happened. But very pleased that Dubuque County was, given a significant grant under the Cdbg grant program.
And if I might, Dave, I know that we have to remind everyone again that this is for new outreach throughout the county. It's not inside the city of Dubuque. I don't know if that's exclusionary. Ed's nodding his head, it probably is. I don't know if the city of Dubuque was going to apply themselves, but so this is for, $99,000 of food supplies and services to be out into our smaller communities. And Resources Unite has developed food pantries out there in many of the small towns. So it's exciting, and it's again another new opportunity for us to be pursuing. And I think it's an amazing grant that we were able to get done with our partnership with ECIA to respond so quickly. And it's great success that we have the ability to deliver these food items, and we have new partnerships with maybe 5 different nonprofits working on food distribution. So great work, everyone.
I'd like to add to that, Ann, that I prepared a media release, and this afternoon, after this meeting is done, Dawn and I will get that out. It explains that a little bit. An excellent thing that you brought up was about the city of Dubuque. These resources from the state were only for non-entitlement areas of the state. And so communities that are 50,000 and over have their own direct resources from HUD, and so they were not eligible. Some of the partners that are included in achieving the outreach may have a location that is in Dubuque, but the resources that are being distributed will be for the areas of Dubuque County outside the city of Dubuque.
Okay, thank you.
I'll make a motion to receive and file the grant award letter.
I'll second that.
Okay, there's a motion to receive and file the grant award letter. Any further discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Okay. Next up, we have item H, boards and commissions update. Item number 1, MHDS Services of East Central Region Governing Board alternate. Is this my report on?
Supervisor Berg, you had asked that this be included in the agenda. You had participated in a meeting for Supervisor McDonough, and I think it was noted somewhere there that you as the board had not elected an alternate to this board. And
okay.
so it would be for you as the board to elect an alternate in the absence of Supervisor McDonough.
Thank you. Thank you for that reminder. And I will report that was, accepted as an official alternate during Friday's meeting, was allowed to participate. But I think it sounds like we need to send a letter in from the Board of Supervisors stating who our alternate is for the mental health region, East Central region. So I think we're kind of doing this after the fact, but we didn't realize we didn't have an alternate name for that committee. So I guess we'll open the floor up for nominations or volunteers. I indicated I was comfortable filling in for Supervisor McDonough on Friday. I'm willing to serve as the alternate. If Supervisor Wickham has a desire to do that, I would certainly step back and allow him to do that. So,
one thing we might think about is that counties do rotate this is probably the fourth time I've mentioned this in my tenure on the board, the counties do rotate supervisors who are assigned to the governing board so that the supervisors understand what's going on and how the process works. And they rotate on and off the board. And we have not historically done that in Dubuque County. And I think it's a smart thing to do. I think it's a wise thing to do. I'm sorry I wasn't able to be there, but Chair Baker, I think you did a great job. And I don't know if Supervisor Wickham, you've expressed interest in the past about maybe being able to maybe be more effective on the board. If you'd like to be the alternate, that would be great.
I defer to the chair. If Supervisor Baker wants to be alternate, he can continue to service that role. If he needs me, let me know.
Okay, I think at this point, I think Supervisor McDonough's doing a very good job on the board. I would be happy to be the alternate for her, and you know, would be involved in any meeting that she requests me to be involved in. And then, of course, in January, the first business day in January, this board will be deciding assignments. And again, I may or may not be part of that. So I would say at this point, the appropriate motion would be to, as I've raised my hand, if somebody wants to make the motion to appoint me as alternate, I would accept that.
I will make that motion to appoint Supervisor Baker as the alternate to the Mental Health Regional Board.
Second.
Okay, motion made and seconded. Further discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Dawn, you'll take care of sending that in. Okay. All right. Next up, we have item I, resolution, appointment of deputies, assistants, and clerks. We have a deputy sheriff, jail division, and I guess I'll refer to Dawn Sherman. It looks like it's replacement of a resignation, so it's not an increase to staff.
That is correct. And again, we are only bringing the essential staff requisitions to you on non-regular board meetings. And so this being in our jail, we want to keep them fully staffed. So I would recommend approval.
Okay. What's your pleasure?
Make a motion to approve.
Okay.
Make a motion to approve the resolution.
And I will second that.
Motion made and seconded to approve the resolution. Any additional discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. On the agenda, item J, resolution, approved 28E agreement with the city of Rickardsville.
Dawn, was there further discussion about this in an updated email? Did we get the language that CJ May wanted included? And is this our final draft?
Yes, what you have in front of you is the updated document from our county attorney.
Okay, so this is drafted by CJ then?
He edited what we had originally received.
He wasn't sure who, I guess Mary Ann prepared at the top it says the preparer's name is the city clerk. But he's reviewed this.
Yeah. Here, I believe this version addresses the concerns that County Attorney May had, because obviously we believe it was inadvertent, but it appeared to give the city of Rickardsville the ability to cancel the agreement after receiving the funds, so it looks like that verbiage has been removed with some mutual agreement language, replacing it, any questions? Again, it looks like it's been fixed, legally.
This is CJ, maybe I could just chime in. Right below the box there, where it has the 5 yearly payments. So the language of what that was there was stricken, and then I added this. As I understood it, the whole terminating, the language about them being able to terminate was if they paid it off early, their thought was then they could terminate the agreement, which makes some sense, but that to me seemed a little broad. So this to me is a little better for everybody concerned.
Any questions for CJ? Not, we're looking for a motion.
I'd like to add, this is Ed. I just wanted to add one thing to what CJ said. I believe that they've already sent this for concurrence with the city of Rickardsville, and they concurred. So I think the anticipation is that your action would be followed by their action and not some other back and forth. Is that correct, CJ?
I think that's right, Ed. I think according to Mary Ann, she had sent it also on to the Rickardsville Council, and yeah, I think this is supposed to be the final document then.
Thanks.
Okay, thank you for that, Ed.
I'll make a motion to approve the resolution that approves the 28E agreement between the county and the city of Rickardsville.
I will second that.
Okay, motion made and seconded to approve the resolution approving the 2080 agreement with the city of Rickardsville. Any further discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Okay, we have a personnel requisition.
Yes, this is, again, is also for our sheriff's department, so it is replacement due to a resignation. So again, not adding any additional staff over there, so this would allow them to fill this vacancy right now versus waiting another week, so I would request approval.
I'll make a motion to approve the personnel requisition as presented.
Second.
Okay. Motion made and seconded to approve the personnel requisition for the deputy sheriff. All in favor signify by saying aye.
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 Carried 3-0. Okay. Is there any other business to be brought up regarding these issues? Otherwise, I believe we're scheduled for 10 a.m. Wednesday. When I asked Tom Berger and Patrice Lambert if that still works for their calendars.
Yeah, that works for me, Dave.
Okay. Is Patrice on?
We should be good on that. I think that's
Okay.
At noon, and I have mine at 9. My web with the state at 9, but that's usually over by 10, so we should be good.
Okay, so I'm looking for a motion to recess until 10 a.m. Wednesday.
So moved.
I will second that.
Okay, motion made and seconded to recess till 10 a.m. Wednesday. All in favor signify by saying aye.
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 Aye. Carried. So we are in recess. Thank you all.
Thank you.